My name is Shelley Winship. I'm from Chimayo, New Mexico. I am currently self-employed as a founder of a nonprofit called Hearts of Bloom. I get my health insurance through the BeWell exchange, and I have since 2019. Last year, I fell off a cliff and broke my ankle, and the bones came out of my leg, and I've had specialized medical equipment. I've had a lot of physical therapy, and my insurance really took those expenses off the table for me. And I was really grateful to have my insurance through BeWell.
My name is Jason Hackler, and I grew up in Santa Fe, New Mexico. I'm a doctor of Eastern medicine. I've had any number of patients over the last months very upset about this and concerned that they were going to lose health insurance. And not only could they not come and see me, it could affect their entire life if they didn't have health insurance for basic, as we all know, medical costs are extremely high right now. And people don't have money to pay out of pocket for those things.
My name's Jen Tara. I'm a yoga instructor and a wellness coach. I've had the health insurance through BeWell for about 6 years. As we get older, our chance for disease increases. My dad had cancer. My mom has a really terrible form of Parkinson's. And so, if we didn't have coverage, that would really scare me. Yeah.
Last fall, when I learned that the feds were not going to extend the tax credit, I was still in recovery from my ankle break, learning how to walk again. I pretty much anticipate that I'm going to have problems with my ankle for the rest of my life, and really questioning whether I could continue forward with the plans that I'd made in my life.
The number one stressor for me personally as the main provider for the family is our finances. And even with the income I have, which is pretty decent, I'm middle class, I can't spend $3,000 a month on health insurance. That would be 50% of my income, my gross income for the month. I was very stressed out. I basically told our family, we discussed that we wouldn't have health insurance.
As a family, as a mom, if something were to happen to my son, I wonder if we didn't have health insurance, then would I even let him play sports? I wonder about that. I also am living with an autoimmune disease, so it's important for me to get blood work regularly and that I have the right medication, the right dosage when needed. Yeah.
And then I found out that New Mexico's legislature was going to backstop that subsidy through June 30th, and it was such a shot in the arm.
If I could talk directly to the legislators, I would say, please, if it's all possible, please continue to protect the health and well-being of New Mexicans by funding healthcare like you are.
If the legislator doesn't come through, we're screwed. There's nothing, no hope. No hope for us.